from a developmental point of view, the developmental lens that we now look at is we're much more interested in the nonverbal piece, the social gaze, the referencing, the use of gestures, the use of emotional tone. Those are the foundations for communication that need to be in place for social pragmatics to be able to unfold in a warm, interactive environment.
Welcome to Tilt Parenting, a podcast featuring interviews and conversations aimed at inspiring, informing, and supporting parents raising differently wired kids. My name is Debbie Reber, and I'm the host of this show. And my guest today is Sherri Cawn, a speech-language pathologist who has specialized in the assessment and treatment of infants, toddlers, and school-aged children with developmental challenges for over 38 years. Sherri has incredible experience and also a bird's eye view of the field and how it has evolved in the past several decades. She's also a leading practitioner of the DIR floor time model in speech and language development, having trained extensively with Dr. Stanley Greenspan and Dr. Serena Wider, and trains other professionals throughout the US, Europe, and Asia on the theoretical and clinical concepts of DIR floor time. In our conversation today, Sherri shares a wealth of knowledge about communication disorders. We cover everything from the different ways the communication disorders show up and what speech-language pathology is, to what types of issues speech-language pathologists support children with, and what signs might be indicators to parents that their child could benefit from working with one. And now here is my conversation with Sherri. Hey, Sherri, welcome to the podcast.
Thank you, Debbie. I've been looking forward to a meeting with you.
I'm looking forward to this conversation. You're the first speech-language pathologist that we've had on the show. I think there's a lot that we can cover today, and I'm just looking forward to sharing your expertise. So to get started, I always love to just ask guests to introduce themselves. So if you could tell us a little bit about you and what you do in the world, that would be great.
Of course. Well, you just heard Debbie introduce me as Sherri Cawn. I'm a practicing speech-language pathologist. I am going to say this quietly, but this month I start my 50th year as a speech pathologist. And people always ask me, is there a reason you haven't retired? And I think the reason would be is that I still love the work. And there's new innovations and strategies and clinical thinking that still makes my socks go up and down. And I'm on a mission to train as many clinicians and families to think in a more developmentally minded way as more children become evaluated and we learn more about different learning styles. As experts in communication, we need to be up to date and flexible in our thinking of how to help support young children, young children, as well as school-age children, adolescents, and on to adulthood. So I have two clinics. I live in the Chicagoland area. I have one in the suburbs of Northbrook, Illinois, and I have a multidisciplinary clinic where we work with children looking through different developmental lenses. And I also have an office in the city of Chicago in the Lincoln Park area. I've been lucky enough to work in public schools, work in the private sector, work in a clinical setting, and have studied and been mentored by some of the best in the business, whether it be psychologists, occupational therapists, educators, parents, of course, always are my best tools for learning. And so I'm lucky enough to have been doing this all this time, and that's why I hope I can be of help.
Wow. 50 years. First of all, just congratulations. That's incredible. I'm sorry, you whispered it, but that's a huge accomplishment and
it is.
It's incredible. So I actually would love to hear, just a bird's eye view of how things must have changed over the course of those 50 years. But before we do that, could you even just define speech language pathology as a discipline or tell us what a speech language pathologist does?
Well, I think the way to define it is to say that we sort of have a misnomer, right? Because the minute you think of it, someone as a speech therapist, because actually when I graduated, we were called speech correctionists. And it's interesting that we were correcting speech, but so you get a degree in speech and language pathology, which in effect gives, so most states in the United States, you have to have a license to do this. And with that license, you have, your state has said are qualified to work with and evaluate children who have a communication disorder. And what that means is that there are several areas of communication disorders that we think about and that most clinicians are trained in. One is, when you think of speech therapy, you think of how intelligible or how clear a child's speech might be. You remember kids who might have a frontal lisp and might say thoop for soup, or you might know kids that say wabbit for rabbit, or you might know children that are more difficult to understand, and that's your first. Most parents are interested in, oh, the way he talks doesn't make sense, when in fact, the most powerful parts of being a speech pathologist center around our understanding of how a child comprehends information coming into them and how they express it. And there's several factors around that. So if you think of communication disorders as a big umbrella, under that umbrella, we would be looking at receptive language, which is the ability to understand. And actually, that happens right at birth. And that follows, if you've heard children that might have an auditory processing disorder. So when you hear that word auditory processing, we're really talking about receptive language. It's just really the discipline that's talking about it. So if you're talking to a psychologist or you're talking to someone who specializes in learning disabilities, or even an occupational therapist, they might use the word auditory processing. But it all backs up to what speech pathologists do, is that we're looking at comprehension of auditory verbal information. And there's a whole paradigm and there's a whole developmental process for that. But you can see how there's an overlap between what teaching reading, being able to stay in a noisy room or be able to listen to what someone is saying while there's noise in the background. All of that has to do with how you're comprehending speech, but sound at the same time. And I think there are a lot of people that like to stay in their discipline, and I wish it was that way. When I graduated, it was that way. Speech people did speech. People with specialist and learning disabilities just worked with those kind of kids. Reading people did reading. But that just isn't the way we know how development unfolds. It's a developmental process where all sorts of different learning happens in many different ways at the same time, and they all affect each other. Now, expressive language has lots of parts to it. It's the articulation that I talked about, but even more importantly, it's how you put words together to make sounds, then sentences, and even more importantly is what we call the pragmatics of language, or how we decide what to say to someone in response to something they've asked us. And that's probably the most difficult challenge that speech pathologists or families might notice first when they're thinking about children with communication disorders. So that's more of the social use of language. How do you know how far away to stand from someone? Some kids like to get really close up, right? Or touching or what, so forth. That would be something we would look at from a social pragmatic standpoint. How does the child understand the social use of language? And that's where the young child, before 18 months, practices that with their caretaker or their parent in the first, I would say, 18 months. That's why the right brain grows much larger in the first year and a half than the left brain. It corresponds with the left brain taking over for speech, which happens between about 15 and 18 months where kids start using first words. But the pragmatic aspect of language is probably the one question parents ask the most. Why can't my child talk with another child? Why does it look like he doesn't understand what that child is saying? How can he not understand nonverbal cues or gestures? I mean, for example, you and I are talking with each other on the phone, and when I stop talking, you intuitively know to either make a comment or ask me another question, right?
Right.
It's your social communication that's telling you that. And you weren't taught to do that. You were wired to do that. We come into the world wired to be social. And we have all sorts of ways of doing it in the first year that set the foundation for how it's going to look when you're 1.5, you're 2, and you're 3, and you're 4. Because in the numbers game, by the time you're 4 years old, you have about 95% of what you need to communicate. Now, I'm not talking about higher level figurative language, being able to write an expository text. What I am talking about is understanding the use of meaningful words, of understanding when your partner doesn't have enough information, of being able to explain or say why you don't like something. And that happens by 4. Amazing, right? It's an amazing amount of information a child learns by the time they're 4. That's why we know so much. The research is heavy and so well studied in terms of how young children learn to communicate. That's probably the most exciting information that's been going on and is on the horizon of what we know about communication. Is that helpful?
Yeah, absolutely. And it's making me realize just what a broad field speech language pathology is. I think many of our listeners and myself included, I thought it was much more narrow in terms of the work that you did. And as far as I know, and maybe one of the therapists that Asher worked with when he was in a public school with his IEP may have been an SLP, but he has primarily worked with OTs. And it sounds like the work that you do, especially around those social cues, this would be relevant for all kinds of kids, on the spectrum, kids with ADHD, kids with sensory issues, just a really wide variety of children.
Right. Which is why you never really look at a diagnosis. You have to look at where the child is developmentally. And what I mean by developmentally is, what does his individual profile look like? How is that child? And mind you, you can't do that in a 30-minute screen on a child, nor do a lot of the tests for communication disorders tell a child's whole story. So you have to go deeper. And the person that you're going to go deeper with is the parent, because there's no one more important to that child than the parent, and there's no one more important to the parents than that child. And so part of any evaluation or part of any understanding of communication is, who is that child, and who are the parents, and what's been their experience with communication, and have they themselves ever had speech and language therapy or saw a speech pathologist. And a really good developmental occupational therapist, by the way, Debbie, really understands the importance of nonverbal communication. Because when you hear speech, for example, it's the most salient piece of developmental information that a parent can grab onto. It's the one thing that would put you at ease if your pediatrician said, well, how many words does he have? And if you as the parent said, well, he hasn't really started speaking yet, but I was a late talker, my husband was a late talker. And so a parent would be very open to having a speech pathologist meet with the child. But in that case, they might be looking to say is, well, he's not using words, when in fact, from a developmental point of view, the developmental lens that we now look at is, we're much more interested in the nonverbal piece, the social gaze, the referencing, the use of gestures, the use of emotional tone. Those are the foundations for communication that need to be in place for social pragmatics to be able to unfold in a warm, interactive environment, if that makes sense. That sets the foundation. Words, that's the easiest for us. But it's the clinicians that are not looking at these foundational pieces and getting those in order in the beginning with, really toddlers and so forth, that we go back and we have children with more fragmented language, more perceptive language, or children that there's a word that we use, sorry to use jargon, called contingent responses. You might see that word on an IEP. And on the IEP, it means, can the child make an appropriate response to someone that made what we call a communication bid? So let's say the speech therapist said, hey, John, you want to play with Max now? And John didn't answer. He might have walked away. You would ask yourself as a clinician, well, did he not understand? Did he have anxiety over what the teacher asked him to do? Or maybe he just didn't want to do that, right? So as a clinician, you're always asking yourself questions, or rather, I would say a developmentally minded SLP, which is what we call ourselves, speech language pathologists. An SLP would say, what made the child go away? How do we woo him back? And how do we keep him there? So those are the three questions I tell the clinicians in my office. And I say to parents all the time, it's not that we did anything wrong, but we might have missed a cue. So for me as the speech pathologist, my job is to help a parent see, oops, something went wrong there. How can we repair that? Because it's in the repair that we get the communication to be attempted again.
During this month of planning and organization for big transitions, rhythms and routines have been absolutely essential for our physical and emotional well-being. So Green Chef nights are reliably and predictably a good night. We know the ingredients will be fresh and prepped, the instructions easy to follow, and the meal delicious. We're all still talking about last week's turkey tacos with mango chimichurri sauce, refried beans, and Monterey Jack cheese. Green Chef contributes to a healthy lifestyle with easy and delicious menus like fresh seasonal salads and green bowls. And with over 80 weekly meal and market options, plus rotating options to suit a variety of lifestyles, whether Mediterranean, plant-based, calorie-smart, keto, protein-packed, gluten-free, there are always plenty of options to choose from. Whatever you select, you'll get farm-fresh ingredients, organic whole fruits and veggies, and premium proteins, all delivered straight to your door. I love those 4 words. Straight to my door. Oh, and one more thing I love about Green Chef, they have an app, which means it's easy to manage meal preferences and delivery from your phone if you want to. And I, for one, want to. I am in that mode where I'm making the most of little moments like waiting in line at the pharmacy or for the F train to pull into the station to tackle all of those to-dos. So the convenience of an app is key for me. Green Chef has a special offer for Tilt listeners. Go to greenchef.com/tilt50 and use code TILT50 to get 50% off plus 20% off your next 2 months. That's 50% off plus 20% off your next 2 months when you use the code TILT50 at greenchef.com/tilt50. Maybe I've watched too many seasons of The Amazing Race, but every time I have to go somewhere on the subway, I treat it like a competition. It's all about making the right gut decisions about which route will get me there the fastest. Sometimes those decisions get me where I'm going early, and other times my gambles don't really pay off. Probiotics can't help with most gut decisions, but if your gut needs a little support, Ritual has your back. Their Synbiotic Plus, a 3-in-1 supplement, has clinically studied prebiotics, probiotics, and a postbiotic to support a balanced gut microbiome. I've been using Synbiotic Plus for about 6 months now, and it's become a core part of my morning routine. I take the mini capsule every morning while making my way through my inbox, whether I'm at home or I'm on the road, because it doesn't need to be refrigerated. And the capsule itself is delayed released, which helps it survive the harsh conditions of the upper GI tract for delivery to the colon, and that's exactly where we want it to go. Ritual invested in a study modeling the human colon, which showed that Synbiotic Plus significantly increased microbial diversity and the growth of beneficial bacteria. There's no more shame in your gut game. Synbiotic Plus and Ritual are here to celebrate, not hide your insides. Get 25% off your first month for a limited time at ritual.com/tilt. Start Ritual or add Synbiotic Plus to your subscription today. That's ritual.com/tilt for 25% off. So what kind of things for parents who are listening and are thinking or questioning, maybe I should bring my child to a speech language pathologist for an evaluation? What beyond those, a child who's maybe not using verbal language in the way we would expect by a certain age, what are some of the other signs that they would be looking for?
Well, I will say this to you. if a parent is first approached about a speech and language challenge, and he's already entered school, let's use that as our benchmark. So, there's a lot of times that children go right through daycare or preschool, and nothing's noted in their communication. They seem to be very social. They, in the preschool, they are, a well-liked child who have good social skills. And so those kinds of kids may not stand out in a preschool. But when you get to kindergarten, and we all know that kindergarten is very different, certainly than when I went, but I bet it's also different than when you went, Debbie, in terms of that, because it used to be more preschool based with lots of time for social communication and play, and play is really, really important. And then children would get the opportunity to practice all of these social communication skills. But now, all-day kindergarten is serious business. So people are working on phonemic awareness, or this ability to hear differences between sounds, and that's setting them up for phonics down the road. Even some sight words, or this interest in journaling. Every kindergarten is journaling. And this idea of having ideas to put into a story, and coming to the rug, following directions, being able to know that when the teacher says, okay, kids, we got to come to the rug, that the child can say, I have to stop what I'm doing and be able to move myself over to follow directions. So this is where it gets a little grayer. So I want to say that, how do you differentiate between what's attention, for a child coming to the rug to hear the story of the day, and then getting the directions of what's at the different learning centers, as opposed to, did they not hear it because they weren't listening, or did they not hear it because they didn't understand it? So if a teacher notices that in the classroom, she might have her speech pathologist in the school come and say, can you come in and listen to this little guy or observe? We'll also be looking to see, what's the child's interest in literacy? Can they retell a story? By 5 and 6, you should be able to retell a familiar story, or even on for example, a wordless picture book that 5-year-olds love, and I personally love children to get lots of practice with that, is to be able to anticipate what's going to happen next. And this is why everybody stresses in preschool, the best therapy you can give your child is reading to them. I mean, you can't have a better gift than that. So that's the first time we see that if the child isn't understanding all the directions in the classroom, can't retell a story, can't answer why questions, or how questions, or when questions. So one is how do you sequence? If I said to a 5-year-old, well, how do you brush your teeth? A typical 5-year-old could say, well, you put toothpaste on a toothbrush and then you go up and down and spit. That's what they would say. It wouldn't necessarily have to be in complete sentences, but you would have an idea that they would know, they would understand what to do. So that would be it. When indicates a temporal idea of time and space. So you would understand words of position like up and down and around and behind and over and under and next to and beside. And you would know that beside and next to mean the same thing. And you could follow directions with 2 or 3 of those directions inside of there. And think about a regular kindergarten classroom. There's a lot happening in there. So let's say, for example, that you're a kid that can be overstimulated visually by a wonderful room that kindergarten teachers set up. If you are overstimulated, you might not be paying attention, which could lead to poor processing of auditory verbal information, and that you might look like you don't understand, but the room itself might interfere, right? And so it would require an SLP to maybe observe in the classroom, besides using some standardized testing. In the world of communication disorders, we have some excellent standardized tests. We do, without a doubt. But does that always tell the whole story? I would suggest that it doesn't, because the problem with doing any formal testing is that the clinician has to work within the confines of what the test says is an acceptable response. So, for example, if we're testing a child's expressive vocabulary, there's a number of tests on the market that are well standardized, have good reliability studies, and give reliable information. And for insurance purposes, and to make a child eligible in a public school program, we would need that kind of formal data. But I'm going to suggest that I think the information is, was the child like taking a test? Where did you notice he had more difficulty? When there was a picture with the question, or when you didn't have a picture and you just asked him questions? Was it easier for him to understand repeating a sentence of nonsense words as opposed to repeating a sentence with more meaningful words? Were numbers easier than words if we're looking at auditory memory? We're mostly interested in seeing how well can the child converse with us? Or is he always asking, am I almost done? Can I go back to my classroom? Which would also say to us, is the child anxious? And are we seeing a true picture? So in clinic, we always see the child. Well, first we get insurance approval, of course, but we always want to see the child in his most natural environment. And we always want to have a chance to play with them before we actually do formal testing. Now, that can, as you can tell, that could probably work two ways, because we're pretty fun when we play. And why would you want to go sit at a table and do work if someone's playing? But we often get to see them at the children at the top of their range when we start with symbolic thinking and symbolic play. And that gives us a window to why we might not be seeing their true communication abilities as well. So you have to look at the informal and the formal, and then you have to look at family history, child's birth history, and see what happened during the child's preschool years. Now, the higher we go up in age, the more you become an expert at the body and the learning style you have. And so for some children, we don't even find out if there's difficulty with what we call word retrieval. And we often see it when the children's vocabulary or the decoding of words is not moving forward. Sometimes the end of second grade, because the difference between second grade and third grade from a communicative perspective is a very important jump in abilities. So oftentimes the parents will say, the teacher's concerned about his vocabulary, or he seems to have difficulty coming up with the correct word. So he might look at a telescope and say, binoculars, close, but not exactly. Or he might look at an apple and say fruit, which would be right, but on a standardized test, it would have to be apple for it to count. But if a child makes a number of errors in that way, we would say to ourselves, I wonder if this child has some word retrieval problems. And we all have difficulty calling words up. And if you're in a situation and you didn't write down your grocery list and you say, I'll just go in the store and I'll remember. And sometimes that works, but sometimes you might be at the deli counter and you need something and you can't remember it, even if you go through all the letters of the alphabet or you go through all the shelves in your refrigerator and you can't get it. And then you'll walk away. Of course, you'll remember it, or you'll go home and you'll remember it. But these are little strategies that you and I have learned as adults. But for some of our kids, they can't get there. And so we have a series of evaluations that will really help a child get there. And actually, speech therapy for a child that's been diagnosed with word retrieval problems is some of the most successful, and those interventions have some of the most successful outcomes. But it affects reading and it affects writing down the road. We usually can pick it up. If we see the child as a preschooler, we usually can anticipate where there might be challenges in first and second grade. But you can see there's sort of like a domino effect here, right?
Yeah, absolutely. And as you're talking, I'm just feeling like there have to be a lot of kids who just slip through the cracks because it just seems like they're not listening, they're not paying attention, they're daydreaming, they're purposely choosing to not follow instructions. I'm kind of curious, going back to that question I wanted to ask earlier about You being in this field for so long, how have you seen things change? Are we moving in the right direction? Are schools and educators more aware of these issues and considering deeper reasoning behind a child's behavior in the classroom?
Well, it depends where you live, and it depends the school district's, educational mission. But I would say in the early 1970, there weren't even words like learning disability or attention deficit disorder. There were words like minimal brain damage, MBD. And that was scary, right? But I grew up in the Vietnam era. So all of these guys were coming back with all these issues, and they were using, it was probably post-traumatic stress, at the time. But all of the carcinogens and stuff that were in the air, I think, had an effect on that. So have things changed? Dramatically, but a lot of clinicians haven't. And so there are more clinicians that hold on to a more traditional sense, particularly if you're in the public schools, because everything has to be documented. Not that we don't document, but we're allowed to follow a developmental profile. So by that I mean is that in an IEP, there's huge books of IEPs that say if a child has a word retrieval disorder, I'm just using this as an example, or they have an articulation disorder, we will write the IEP. For those people listening, you know how that works. That works off of percentages, and each quarter you just change something by one tiny little dimension to see if the child's made progress. So that always, I'm an advocate. I do a lot of work in the schools where I represent our clients that go there. And I think speech pathologists in the schools have a very hard job because they have to be a general. They have to know a little bit about everything. And that's not always easy to do that. And so their IEP goals may not really reflect the child's developmental profile. And what I mean is their motor profile, their sensory profile, their communication profile, their social emotional profile that seems to be very departmentalized. When in fact, research is talking to us about how we have to look at things through these developmental lenses because each area of development is dependent on the other. So I would say that's maybe changed in the last 20 years, but in baby steps. So I still think we have a ways to go in that way. But I think parents can be really good advocates when they really understand what's going on, what is exactly interrupting a child's, I'm going to use communication because that's my area of expertise, what's interfering with their communication challenge. Because yes, you could have ADHD and a communication disorder. In fact, there's sort of a classic profile with that. So oftentimes we see kids come in for speech and we already see their need to move quite a bit. And so they miss some of the details in sending a communicative message. And so I think the more as clinicians we can be informing parents, the better advocates parents are. And not in a way that sounds angry or anything. I just think that it's my job to inform my clinicians to help work with the SLP and the special ed team at the school to say, how can we look at this goal and measure it so we're really getting accurate data?
Hey there, it's Debbie. I love making this show and sharing conversations about how to support our awesome neurodivergent kids. I've seen how even one little insight from an interview can spark a big shift in daily life. But I know that raising complex kids can be messy and lonely. And just when we think we figured it out, something comes up that boots us right back to feeling overwhelmed and stuck. That's why I've poured everything into creating a way for parents like us navigating complex parenting journeys to join together and chart a path that feels positive, hopeful, and doable. It's the brand new Differently Wired Club experience. In the club, you'll get personal support from me and other seasoned parent coaches, 6 live calls every month where you can connect and get your personal questions answered, the opportunity to learn directly from authors and experts like I have on this show, monthly themes for getting specific and tactical, an exclusive private podcast feed, and the best, most generous community of parents. Seriously, these folks show up for themselves and each other, and that right there is really everything, because it's a daily reminder that we're not alone. Our kids aren't broken, and we have totally got this. The recently rebooted Differently Wired Club is on a brand new platform with its very own iOS and Android app. It is such a great space. However you learn, whatever your style, no matter the ages, genders, and neurodivergent profile of your children, the Differently Wired Club can help you cultivate the positive shifts you're hoping for. Join us today by going to tiltparenting.com/club. That's tiltparenting.com/club. I hope to see you on the inside.
Hey, are you a parent of a teenager? Are you feeling overwhelmed about how to be what they need while also holding limits and boundaries that keep them safe? Are you tired of conversations that negate how messy this season of parenting is? Well, I've got you. My name is Casey O'Rourke. I am a positive discipline trainer, parent coach, and the host of the Joyful Courage podcast. Every week, I come to you with an interview digging into tough topics with experts I trust and solo shows that go deep into the personal growth and mindset needed to raise teens in a way that grows them into confident, capable young people. I am not afraid of getting real about the intersection of conscious parenting and the teen years, while also bringing in vulnerability, humor, and lightness. I'm walking the path with you and honored to serve. Listen to Joyful Courage on Apple Podcasts, Spotify, or wherever you consume podcasts.
So if we have a child that is more self-directed and they're working on peer relationships and the child doesn't respond to a communicative bid from another child, and you're saying with an adult prompt, with 4 adult prompts, he will do it 85% of the time. What are we taking data on? The prompt that you're giving him or anything spontaneous? Why does it only have to be in percentages? Can't we look at something for a 5-minute period or set up something that's in the child's interest and then take the data? So my goal as an advocate is to go in and say, we're both going for the same communicative goal. We're just taking data in a different way. The other thing that gets in our way is RTI. Of course, I just forgot I just can't tell you what that acronym now is because this is what happens after 50 years. It's a tiered program that looks at kids' severity, for example, in communication disorders, and decides, I'll look at them once a month, or I'll see them I'll push into the classroom and maybe work on the S sound and the R sound, but I'm not going to enroll him as a special needs kid and give him an IEP. So I think that often happens with, I can't believe I can't remember RTI. So with the T and the I is to intervention.
I just looked it up. Response to intervention.
Thank you. See, there was a word finding problem there. I was going through the alphabet. I knew I would get there eventually. But what I'm saying, Debbie, is that if you have a kid in RTI and he's still at the lowest level, it could be a year since maybe he gets a full evaluation or they noticed word retrieval, right? And they're working on articulation. So that's always where, for me, the rubber hits the road, and we have to up that. We have to sort of, in a collaborative way, help the school move to opening up a case study for that child. Because communication disorders often reveal other areas of difficulty. Could be reading, could be writing, could be just the ability to be socially present and mindful. And of course, I could talk about this forever, because that's another thing I want to do is say to SLPs, we can work together. Just because I'm in the private sector doesn't mean that I want to write your IEP. I don't. Because it doesn't matter if I write your IEP. You're the person that has to deliver those strategies. Mm-hmm. But together we could make a beautiful team.
How can parents be the best advocates they can be? What should they be paying attention to in the school system?
So I would say, and again, I would say this for a reading specialist, I would say this for the social worker. I always laugh now, particularly in Illinois, where I'm from, is that sometimes the social workers and the speech pathologists work together on social groups for kids with social communicative disorders. But a lot of times it's out of the speech pathologist's hands. And that's crazy, right? I mean, this is what we do. This is our baby. We should be advocating. And oftentimes it's the social worker who's following a curriculum. And so she picks up the kindergarten curriculum and she has the kindergartner in it. But what if that's not where he's at? How do you go back down and, where is that in the goal that he's not there yet? This is what we're going to work on. That would be one thing. As the parent, I would ask them to, number one, to get a better understanding of, tell me what therapy is going to look like. When I first talk with a parent, and I'm sure happens for you, Debbie, too, when we're not even looking at each other, and yet we're able to communicate, even though you're letting me do all the talking. If I was meeting a parent for the first time, for me, the first phone call is where the relationship begins. And talking with the parent, you, as an intuitive clinician, and yes, I have a lot of experience for sure, and I've worked on this, of course, that I want to know about as much about that child and that parent as I can, so I get a better understanding of the parent's worries, as well as what joy that the parent is able to find. What do they like to do the best with their children? So I am ready with those kinds of things when that child comes into clinic. But the most important thing is that my job is to be a clearinghouse for the parent. So I'll send them articles. If the teacher says, I'm going to have my speech pathologist take a look, I would want to talk with that speech pathologist first. I want a relationship with that person. I want to know, what's your experience in working with kindergartners, and do you do formal tests? Do you go to observe? Do you get to know my child before you test him? Because when you come to that meeting, it will be you, another special ed coordinator. You'll be sitting at the table together, and they'll be giving you test scores. My feeling is, and this is on a personal note as a parent, is that we cannot tell parents 6 things their children can't do. We can tell them 3, but you can't tell them 6, because there's some research that says that parents really can only listen for 10 minutes. And I, as a parent, now my children are adults, children of their own now, but I remember being in that room and hearing only screaming in my ear that you have to stop talking now. No, you cannot say another thing. This is my baby you're talking about. And so I'm very sensitive to how much a parent can hear. And particularly when this is the first time they're finding out their child might have a communication disorder and what that means down the road for them educationally and so forth. So I think that's really important information. And I always like to tell a parent, when you go into the meeting, you want to see a draft of the report before you go in, because there might be things in there that aren't right, particularly if you're the parent and you were sitting in on the evaluation.
Mm-hmm. That's very good advice. And it's something, we've talked about in previous episodes. So thank you for repeating that. It's a tough position to be in, and it's tricky in terms of really trying to design positive alliances with educators in the school system. And that's something I really want to be a part of. And it's difficult. It's difficult.
And it depends. I think, when a teacher digs in, it doesn't get pretty on the way. But I think developing relationships, which I've been lucky enough to have for decades, with people that I can call them and say, that meeting didn't feel good. We've got to talk about how to do better next time, because this is what the parent said to me. I want to share with you how they felt. And so that coordinator will go and repair with the parent. So I feel like we're moving in the right direction, but in baby steps.
Well, before we say goodbye, I would love if you have any favorite resources that parents should be aware of, if this is something that, is really resonating with them and they want to learn more, dig more maybe into some research. Do you have any go-to resources for us?
Well, I would say if you're interested in learning more about communication disorders, the American Speech and Hearing Association has a wonderful website for parents, and talks a lot about evaluations and so forth. And they've redone their website, and I think it's very parent-friendly. I would also tell them to go to their school district and look at their Common Cores and what their philosophy is and their mission statement and so forth. I think that rings true and gives you a really good idea of how things will look if you're transferring from to a different school district or a different state, to see how your IEP will work.
Great. Well, and is there a place that listeners can connect with you or learn more about your work as well?
Of course. So you can reach me at www.cawn, CAWN, that's me, -Krantz, KRANTZ.com. That's our website. That's currently a bit under construction. Or you can always reach me at Sherri, SHERRI, S as in Sam, L as in Leo, P as in Paul, at Comcast.net. I'm great at email.
Excellent.
Harder than phone calls.
All right. Well, that's good to know. And listeners, I'll include links on the show notes pages if you do want to get in touch with Sherri or learn more about her work. But this has been just fascinating. I learned so much. So thank you so much for sharing all of this with our audience and for coming by the podcast.
Yeah, it was an honor for me as well. So I'm in your audience, Debbie. I think you're doing an amazing job. So thank you for letting me have the opportunity. I look forward to hearing if your listeners have any questions.
You've been listening to the Tilt Parenting Podcast. For the show notes for this episode, including a link to Sherri's website, her email information, and all the resources we discussed today, visit tiltparenting.com/session168. Don't forget to leave a rating or a review or both for Tilt Parenting on iTunes if you haven't done so already. Those ratings and reviews help keep this podcast visible in an ever-growing sea of podcasts. We're up to nearly 1.25 million downloads, so this is working. Thank you so much for your help. Lastly, for the price of a coffee at your local coffee shop once a month, you can support the production of this show. It's easy, it's pain-free, and I would be grateful for the help. To learn how to sign up and support this podcast, go to patreon.com/tiltparenting. And that's all for this week. Thanks again for listening. And for more information on Tilt Parenting, visit www.tiltparenting.com.
If you're a parent, I invite you to join us at the Mindful Mama podcast, where it's all about becoming a less irritable, more joyful parent. With sometimes hilarious and always thought-provoking experts and friends, at Mindful Mama, we know that you cannot give what you do not have. And when you have calm and peace within, then you can give it to your children. I'm Hunter Clark Fields, and I can't wait to see you there. Listen in to the Mindful Mama podcast.